right. It's a pleasure to present to you this morning on slides that I put together in order to actually propose, organize ideas for a proposal to NSF. My topic is about resilience of a community that's vulnerable to climate change threats. I'll start with some background information. We'll set out some objectives, some benefits, an idea of how resilience could be measured for this population, an idea of how to enhance resilience, and some conclusions. I may have to go quickly, as I'm told I only have 18 minutes. I'll start by introducing what vulnerable means. Vulnerable is anyone basically that's unable to plan or enact life or property protection responses to cope with a threat. And here I'm mostly interested in hurricane threat. Due to typically to lack of resources. Those resources may be material or immaterial. So it could be due to physical health. We could have sick people. It could be a lack of money, lack of social capital. That means friends, people that are invested in your welfare. Language could be a migrant community, cognitive capabilities, mental health, etc. So with the coming of age of baby boomers and also with the threat of climate change, we're really at the intersection of a situation that could make this topic quite interesting. Resilience is basically what we're shooting for, and that affords the means to adapt and cope. The way to demonstrate resilience is through preparedness. It is accepted that preparedness of a social unit and society is divided into multiple units. We start with the family. We could go into the community. We look into business. And here I'm looking mostly at family units. So welfare of a family would hinge on the preparedness of some of the other units. Otherwise stating a man is not an island unto himself. We need systems to be put together. Preparedness requires the collaboration among the units and not simply top-down directions. In the past, we've expected to just give out an order of evacuation, and we thought that that would do the trick and that everybody would actually follow suit. But that's not quite the way it happens. So the study objective is to derive methodologies to assess and enhance the resilience of the coupled, and I'm looking mostly at the intersection of water and transportation system and their impact on the vulnerable population. The benefits would afford much needed life and livelihood protection to the vulnerable and its socially linked population. We do have vulnerable people in our populations. And what happens is that loved ones tend to stay together, and not just the vulnerable are at risk, but also relatives and people who actually care for them. The idea is to move from a model of costly federal state rescue recovery of the vulnerable, where the vulnerable is left behind, to cope on its own, and then in hindsight to go and into recovery or rescue, but to actually afford sustainable model for life and livelihood protection of the same population. So we're thinking first into looking into models of resilience assessment. So considering basically the risk that's posed by climate change threats to the lives and livelihood of the vulnerable population, and the flexibility and adaptability toward adequacy of the response frameworks, the ones that exist, to the risk given their dependencies on water and transportation infrastructure. So we'd look at the impact that may happen to water and transportation infrastructures and how that would permeate into vulnerable population given the social organizations of the networks to which those populations are tied, and of course their interactions. We also looked into enhancing the resilience of the coupled system. So first, we'd go into the derivation of frameworks for the life and livelihood protection of the vulnerable population to climate changes. And we want those plans to be flexible and adaptable, because there's always what may not be foreseen toward the overall response, an adequate response. So we'd look into water and transportation infrastructures. We'd look into so culverts, bridges, highway network links, etc. I've worked with people from New Hampshire, and it occurred to me that they didn't even know the extent of the culverts that they had. So that's one project they were looking into doing, because a lot of that stuff is very, very old. And then looking into the population itself and its social organizational network. In terms of enhancing the system, the response to hurricane threat is twofold. You can either shelter in place or you can evacuate. With sheltering in place, we're talking about the ability of maintaining basically maintenance of plan, whatever the common plan would be, or either evacuate. Evacuation, we're mostly looking into evacuation within the community. And that's also into specialized and appropriately equipped. We're very much concerned with people with medical needs. So we want to make sure that their needs can continue into sheltering. And also staff facility. And also sheltering with highly compatible evacuees. Under shelter in place, need satisfaction only amounts to the maintenance of plans, as I mentioned before. If you're evacuating, then you really have to look into alternative plans, so it's a monstrous effort. So more resources need to be deployed in evacuation rather than in sheltering in place. So we need viable frameworks, basically, that should attempt to decrease evacuation demand through zoning regulation. So zoning is one thing that we stress here. To enhance resilience of the coupled system through a few ideas, thinking of intelligent and smart management design system, that's because of their adaptability and their flexibility. And resilience is all about that, adaptability and flexibility. The main mean of enhancing the resilience of a vulnerable population is through the provision of resources, and we expect those resources to meet all the needs of the vulnerable during the response period. So firstly, there's a work to catalog those needs. So that's where we might need the help of a data miner, or we need to be able to survey the population to determine what all the needs are. Also, the framework shall draw from proxies. If we're talking about vulnerable, we've already mentioned that they're unable to enact or even plan on their own a response to a threat. So it becomes important for somebody else to act in their favor, and we're thinking first to go to the social capital of this vulnerable population. That means people that are emotionally tied or linked to the population. And then truly we're looking into public-private partnership in order to enact a global effort to help the population. So it is also intended for this framework to be orderly, effective, exhaustive, and efficient. So these are some of the requirements. It should monitor and adapt system interaction that increased demand. We want to make sure that we prevent an increase in demand through the coupled system that we've mentioned, water and transportation systems. In essence, we want to be able to anticipate what the consequences are going to be for this system and know exactly what's, take mitigation actions to decrease the movement toward evacuation. The framework should enact an early evacuation wave. With the most vulnerable population, we may have people on life-sustaining system, on oxygens or things of the sort. And it is important that they don't be caught into congested period of evacuation in transportation. We also think that the fleet to move this vulnerable population may not be adequate. We only have so many ambulances and ambulance and things of the sort. So we'd love to look into a movement to adapt some of the vehicles that we do have in order to provide the help that's needed. Okay, so the framework should optimize also the location of evacuee shelters. We're looking into the optimization of the shelters to minimize the cost of service supply chains. Eventually, if it is a catastrophic event, people can't go back. They're located in certain geographic areas. We want to make sure that they're accessible. And also, at minimal cost, we want to maximize the reliability of those chains that will continue to serve them. And it would be great to emphasize chains that already exist that have excess capacity and that can be quickly brought up to speed to help these populations. So the location of residential areas relative to the safe zone and to the critical water and transportation infrastructures and their performance reliabilities under climate change impacts. So this is a logistic part of the problem that we would love to solve. In fact, I'm looking at multiple research problems within the framework that I've mentioned. Alternately, the framework should identify facilities critical to the life and livelihood protection. If we have within the water system and within the transportation system infrastructures that are truly critical, we want to be able to identify them early, the ones that would have the most impact on this vulnerable population. We'd like to identify them early to go into an effort of maybe beefing them up. And we're looking into a framework that is affordable. So the first idea that we've generated, some of the ideas that we're floating around now, is the idea of ensuring the whole movement. And also involving multiple actors within society into this movement of the vulnerable population into shelter, the maintenance of their healthcare needs and whatever needs they may have within the shelter, which is kind of a novel idea. So that's why we're talking about specialized shelters in themselves. So we're looking into civil society and NGOs to provide those functions, educational, basically shape the preparedness of the population. So educational campaigns, seminars, yearly training, school curriculums, referrals also of individuals. Might be ways to channel individuals that we know that are vulnerable in the same way that the postal office now look after older people, making sure that they pick up their mails. So maybe doctors could refer them, whatever system we may create. We're looking into government to fund those NGOs, to certify them, to extend shelters, to research into how to motivate collaboration. 5 minutes? That's too much. The vulnerable itself should develop. Of course, we've already mentioned that there may be people that are unable to enact plans, so hopefully they're surrounding. But they should be imbued of the awareness of the threat. So it is their duty to attend or to follow those channels that refer them. They have to apply to an insurer. I was thinking public, could be private. We're a little, we have to decide which way to go. Typically with catastrophic event, I'm afraid the public is left with picking up the tab. But we're still talking about the cheaper tab than the one when you go behind in order to rescue and recover. We're talking about prevention and an organized movement into evacuation. They should receive their service assignment, familiar, that means predetermined location, destination, service that would be that they would need over there, that would be pre-assigned to them by the insurer through a provider. Familiarize themselves with the service. When it comes to the insurer, of course, they have to review application, verify providers and supplies availability. We're looking into means of creating capacity and knowing beforehand that capacity is available also. So that was my idea, to turn it to the private sector and make sure that this is all being done. So insurer will verify that the provider has enough supply, so enough capacity to handle all of these health need, nutrition need, housing need, all the needs that have been inventoried. Makes provider agreement and assignments, issue binders, issue service assignments, issue preparedness brochure. We want the vulnerable, mostly the highly vulnerable, to be able to live within a minute, in the same way that a pregnant woman just pick up a bag and leaves when the call occurs. They're ready. So so the insurer would provide a brochure that tells them exactly what to pack up, and also to break the reluctance to go into shelter. We highly recommend that they familiarize themselves with the place that they would be headed to and the services that they would receive. With regard to the provider, they have to receive the service demand. Compare demand to supply. That's where we're trying to ensure that we have adequate supply, and we know that it exists. If demand is met, then you should secure agreement. If it is not met, we have to go into getting additional supply, whether it's housing, whether it's health, whether it's medicine, drugs, or whatever is needed. Enter into mutual aid and resource sharing agreements with other providers. Verify that reserve capacity is met. We want to keep some sort of reserve capacity with the provider. Of course, the way the evacuation would happen is that somebody would issue the evacuation. It's not a governor, I believe, that issues it here in Rhode Island, but most places it's governor that issues it. Then the insurance company, once the order is issued, would activate themselves and get the providers involved. The vulnerable would finalize their readiness plan, and they should stand ready to evacuate. This is an early wave of evacuation because we have people, we do have in our communities individuals that are on life-sustaining system. We're very concerned about people on dialysis. They have to have their dialysis maybe 3-4 times a week, and it has to continue throughout whatever emergency may occur. Providers themselves should be ready, should contact the vulnerable group, should provide a schedule for pickup, and a chain of service would then start. Transportation, housing, nutrition, healthcare, all of that is contained. It's not just one service, it's a chain of service. For the feasibility, we'd have to survey the vulnerable population, determine a taxonomy of the population, so what exactly it entails in terms of serving the vulnerable population, who is contained, what are their needs, determine extent and need, determine compatibility, whom we can put together. That should be easy in medical wards, at least if we're talking about medical needs. We know exactly how to separate wards and things of the sort. Complement insight gained. Want to generalize results to communities. If you've surveyed, then you expand it to have an idea within our community who's there. Generate demand for service within community. Compare demand to supply. Conduct cost-benefit analysis. This is an attempt at taxonomy. Timeliness of the framework. In the wake of Katrina and Sandy, we've seen a number of upheavals. Also, there's a big effort to remove people from the flood zone or increase the cost of insurance within the flood zones. And we're thinking that over time, there would be less and less people to insure, and those in the flood zone would actually be able to afford insurance such that the private sector can pitch in. As I mentioned, social responsibility will be fulfilled as we're taking care of our most vulnerable. The evacuation itself would be orderly because we've already predicted the range of actions that would occur. We have service pre-arrangements set up, pre-assignments, training, early evacuation. It would be exhaustive because our vulnerables are not left behind. Also, there's a social component here. We need to build trust. You need to contract an immigrant population. You definitely need to be culturally sensitive. And you need to build awareness. Effective evacuation, we're talking about an early evacuation wave to prevent the congestion that could ensue. We've talked about qualification of businesses, insurance, supply chain, continuity of business. We're reducing costs because we're not in rescue and recovery. I guess I'll stop here. Thanks a lot for your attention.
One question, and then we're going to head over to the University Club.
Anybody interested in funding?
There's a question right here.
You mentioned the importance of zoning. Can you expand on that?
Zoning, what that would mean is that land, you align land to certain functions, basically. And what I was looking into right here is that if you're talking about vulnerable population, you probably would prevent a nursing home or something in the sort to be in the flood zones. So we would include some of those provisions that, just to decrease the extent of evacuation that you would have. But unfortunately, part of it is also preventing people who don't have the means to escape the evacuation from living in there too. And some of that have already started with the increase in price of insurance, flood insurance around the coastal area. Good or bad, I'm not sure, but I think it will work for the evacuation. But unfortunately, there's a social effect. You probably won't have, you and I can't afford the ocean view anymore.
Right, thank you.
Thanks.
Thank you.
Thank you, Prof.